Oh, how are you?
Hey, doing great. How are you, Dr. Gulani?
You tell me. More important, how's that eye doing?
Fantastic. I actually drove up from Orlando today and was able to see great in my only healthy eye, my left eye. As you know, I'm legally blind in my right eye. So, that's without contacts. I was able to drive up from Orlando today. So, seeing much better, clearer, and farther than I did before surgery.
It's amazing. Good to know.
Yeah, very happy. Thank you so much.
Thank you for your trust. No, listen, I'm blown away. It looks nice and quiet. You've dressed up, which I like.
Oh, thank you. I'm working today. Right after
And you
this.
drove 2 hours, so I don't like that, but I'm happy. And no, again, like I said, this is your only eye that I worked on for the scar. So please, careful. We call this the precious eye.
Yes.
Because you lost your right eye to trauma long back. And this eye, like we discussed, very, very high risk because it's the only eye. But I'm thrilled your vision's already better than 2040, potential 2020. That's coming from count fingers.
Well, most importantly, I am seeing a lot clearer. You know, even at the baseball fields, watching my kids play.
Come forward, please.
Been amazing.
Okay, lovely healing, full epithelial healing, very well, residual area, just cornea clear. No, thank you, looks phenomenal. I just saw the images they took. That's your scar in the center and you had count finger vision. This is you. Excellent, no. Please again, protect the eye, use your medication, drops and everything, and I want to measure you again if you travel back in another 3 weeks.
Absolutely. Thank you so much.
Really a pleasure. Excellent.
Great.
So Noel, in your case, not only did you have a full thickness scar, not just a superficial scar. If you have a superficial scar, what I do is I do the laser and I literally peel this off and the patients are 20/20, clear. With you, your scar was very deep and the cornea was thin and irregular. So you had scar like all over and very irregular and not to full thickness that too, blinding you completely.
Yes.
But my concept in these cases is not to chase the scar, but to chase the shape over the scar. So what I did is I disregarded the scar and I went with the excimer laser and I made this shape a perfect basketball shape, spherical. In that process, the welcome side effect is while I was shaping the cornea, some of the scar also came off. Does that make sense?
Absolutely.
That's why today when you're seeing your scar is hardly there because like a carpenter's plane, the shavings that came out, most of it was a scar, even though that wasn't my primary goal. My goal was how to shape you with the excimer laser as shaping you on the cornea. So that's the concept of what I did, and this is what I love about this concept of refractively chasing your scar. Now you are high risk because it's your only seeing eye.
Right.
Hence I told you to think about it so many times. And transplant, yes, your surgeons were right in saying transplant is the only option, but again, I'm thrilled with your results. Today you're seeing already better than 20/40, coming from count fingers, and you drove all the way from Orlando. I don't know, any thoughts from you? Any questions?
Again, this makes perfect sense because I'm seeing much clearer, much farther,
Any
and better
pain?
ever since I had my corneal ulcer. So, no. I mean, even from the time I got out of surgery till now, absolutely no pain.
No pain.
So, great
Excellent.
job.
Well, my pleasure. Again, you're in the medical profession, so it's even more fun explaining the concept to you. And this is what I love surgeons to do and help people like you rather than go to transplant. That should be lost for some.
You've made my life a whole lot better, Doc.
Thank you again, Noel. So,
Thank you. Hi, I'm Noel Keller. I have been a patient of Dr. Gulani's for the last couple months. I recently just had surgery on my left eye. I have been in the medical profession for almost 12 years. I drive for a living and I am legally blind in my right eye from trauma when I was 8 years old. But about 1.5 years ago, I had a bacterial corneal ulcer that left a horrible scar directly on my corneal, on my left eye. And I have been struggling with that for the last 1.5 years. I went to many other doctors and was told to, you only had a few options. corneal transplant, fish oil, Restasis for dry eye, which actually gets costly. But my biggest difficulty for the last year and a half was seeing people's faces, seeing my boys play baseball on the baseball field, just being able to play catch. So I was stuck in a hard gas permeable contact for the last year and a half. In December, I came to Dr. Gulani looking for another option, possibly. I found him on the internet through some searches, and quickly realized how passionate he is about helping patients see again. Especially a patient like me who's been told no his whole life and was left seeing out of his left eye not so good. So here we are today after surgery. The surgery went fantastic. Corneoplastique. It was a 5-minute surgery, relatively no pain at all. And today I'm excited to tell you that I drove from Orlando, Florida to Jacksonville. I'm seeing 20/40 uncorrected, and I couldn't be happier. So, so far so good. And Dr. Gulani to me is a lifesaver. He's changed my life. He's given me a second chance at life when I was told no by a lot of people. So it means the world to me, and I can't thank him enough for what he's done for me and my family.